Welcome, everyone, to our first webinar for 2016 for the Connecting Kids to Coverage National Campaign. We're excited to start the year off with this great topic about planning an effective media strategy for 2016, and also bringing our contractors who've been working with us on the campaign for the last 3 years, Fleischman Hillard and GMMB, to the call, and they've got some great experience that they're going to share with us. And then in addition, we have got representatives from Healthy Together in Pittsburgh, a National League of Cities grantee who will be sharing their hands-on experience of implementing social media in their campaign. For today, we're going to be talking about tailoring a social media strategy to fit your needs, implementing a paid social media strategy, leveraging the power of social media. I'm going to share some information about our Connecting Kids to Coverage campaign resources, and then we'll have a moment at the end for questions and answers. Various forms of media, including but not limited to social and paid media, can be used to bolster existing outreach efforts or help an organization reach new audiences. And different media can be managed at varying levels of effort. And so, for example, there are paid advertising tactics that are low cost and low effort. So, as I mentioned, our speakers are going to share tips, best practices, and things to consider when you're planning your media strategy for 2016. And we're going to start off our webinar today with a poll question. What social media channels do you use? Please submit your vote by clicking on an answer that is on your screen. And with that, I am going to turn over the mic to Jenna Carter, who is an account supervisor with in the digital practice at Fleischman Hillard. Jenna?
Hi, thank you. I'm really excited to be here today to talk a little bit more about how to come up with a social media strategy, how to best put that into practice, and what kind of things you should be looking for just from a social media and content perspective. We're just waiting for a second to see all of these poll results come in. I think no surprise here, 91% of you are active on Facebook, followed by Twitter, Instagram. It looks like LinkedIn is a little above Instagram, and then Google Plus to round out the list. So I think we can skip straight ahead to the next slide. Next slide. Okay. So, I think we want to start by talking about what we mean by social media overall. Really, we're talking about places you can create content, places you can share content, and places online that you can engage in a real conversation with your audiences, whether those people are patients, schools, healthcare clinics. There's really a whole range of different options. So based on the poll question, I think we can talk a little bit more about Facebook, which is certainly the largest of all of these channels, and then talk a little bit also about Twitter and LinkedIn as different opportunities to reach different audiences based on your goals. So with that, I think we can skip over to the next slide. Okay. So really where you want to start with your social media strategy is very similar to how you would approach your business goals, your marketing and communication goals overall. So you want to first lay the groundwork to success. Think about who your audiences are. Are you trying primarily to reach patients? Are you trying primarily to reach healthcare providers? And what kind of order do those audiences look like? So there are ways to reach both, but the tactics might end up being a little different. So it's definitely important to think about kind of who you want to reach first and who you might reach in the process as well. I think also what people often miss when they're starting out is really thinking about where your audiences are currently and what they're talking about. So do they have a lot of problems with customer service? Are they asking questions that you should be answering? Or are they really just looking for more information and more resources that you have available but that might not be promoted on social media channels. Then I think finally, one of the key questions to ask before you begin is to think about what success looks like for you. So obviously, if you're a consumer brand or a very large company, success is going to look very different from being a community health organization or something along those lines. And I think there's a lot of variety and a lot of ways to be successful on social media. You just have to be aware that these measures of success might look very different depending on your company. I think we skip to the next slide. So after you've kind of established those goals, established who your audiences are and kind of what they're looking for, you really want to think about your social media brand voice. This can definitely change depending on the channel, but really think about who you are as a brand, as a company or an organization, and how you can best reach your audiences, whether that's in kind of a personal way, whether you're responding to people in first person, whether you are providing kind of an educational angle, or whether you are kind of going into more scientific research or that kind of thing, or certain policy issues. There's a whole variety of different ways to communicate with your audiences on channels. So one thing you might want to think about is, what does that look like depending on the channel? So on Facebook, for example, you might want to be a little bit more personal. Facebook is somewhere where people talk to their friends and family, they catch up on puppies and babies and all kinds of other things. And to break through kind of that noise, you really want to have kind of that personal angle and talk to audiences in a way that is friendly and engaging. On LinkedIn, I think that's the place to be a little bit more professional. People coming to LinkedIn are looking for a place for information and for that kind of thought leadership resource. So that's definitely something to think about. And then on Twitter, I think there's a whole variety of different ways to play your content and to reach your goals. So whether that is kind of a more customer service feel, where you are really talking to your audiences directly, looking for conversations that they are already part of, or what they're saying, and responding to them that way, or whether you are taking a more proactive approach and really pushing out content that speaks to different resources, different news and updates. So I think there's a lot of different ways to go here, but hopefully this is kind of a clear roadmap of different ways you can think about starting out and kind of writing up what you think works best for each channel based on your own experience. So after you've kind of established who you are, who your persona, who your personality is on social media and on those different channels, it's really time to start thinking about content. So I think the first place to start is to really think about how you're providing value to your audiences. You've already established who those people are and what they're talking about and what they really need. And from that, I think it makes it much easier to think through some different content options. So really, no matter what, you really need an objective for each piece of content. So whether that is to educate, whether that is to help someone individually or to help a specific group, whether that's to inspire your audience overall. So, not everything has to have kind of a very direct angle. You could be posting something a little more general. But the key here is to think about what your objective is and how that relates back to your goals. I think we see a lot on social media, and I'm sure you all have experience with this as well, with kind of just content is everywhere. So there is so much stuff out there online, and finding that piece of content that is valuable, that you and your audiences really resonate with, is the main key to success when you're talking about content. I think another helpful way to kind of set up your roadmap and break this down into a simpler kind of overall look at what your calendar will look like, what your content will look like, is to think about where the content comes from. So thinking about both content that you'll be creating and content that you can draw on from other sources to kind of keep that engine going. I think a lot of people are often kind of overwhelmed by the nature of social media and that it is always on. But I think one way to look at that is to really see what other people are doing in this industry. Think about what other organizations have found success, and I think that's something we're going to talk about a little later, is kind of how other people and how similar organizations have found success with communities and with the audiences that you're trying to reach. Lastly, I think this is the fun part, and this is where creativity really comes into play, and there are a lot of different ways to do this, is to think about how will you make your content sing. So whether that is creating an animated GIF, whether that's using a popular internet meme or playing on some other type of content, or whether that's really drilling down into different trends and different opportunities that you're seeing online as you're creating this content. This is the way to make your channels fun and really make this something that people not only find valuable, but they find entertaining as well. So here we have kind of an overall look at different ways channels are used. So after you've come up with your overall content pillars, what you want to talk about, and those different audiences, you can really start to get very granular in who you're trying to reach and what you're trying to say, and importantly, how frequently you're trying to say that. So this is kind of a top-level look at what makes each channel the most successful. So I think, again, here, this really depends on who you are as an organization and what you're trying to achieve. So if you are really talking to parents specifically, for example, I think Facebook is a way to best reach them. Parents are very active on Facebook. They have that kind of personal connection to the platform that they may not find on Twitter or Google+, for example. If you're trying to reach professionals in a healthcare organization, LinkedIn might be the perfect place for you. I'm really thinking about how can you tailor your content and what you're saying to best fit each of these different platforms. So this is just a great resource to kind of think about how people are using each of these channels right now, and how you can find different ways to kind of get involved with them as well. So again here, I know I talked a little bit about Facebook already, and different ways that your audiences are using each of these channels. But I wanted to give a little bit more of a specific breakdown. So one key stat that I thought was really interesting was that 79% of parents who use social media agree that they get useful information from these networks. So I think the key here is that in some way, whether you're talking on Twitter, whether you are posting a photo to Facebook, or whether you are creating videos for YouTube, there are a variety of different ways to reach parents. But the key here is that they are using social media, and I think this will only continue to grow. I think the other key here is the last bullet on this slide, that health messages specifically delivered to low-income parents must come from experts and really be personalized to build that level of credibility. Again, there is so much information out there, and finding those key messages that really talk to your audience will be very important to success. All right, so I think here we want to talk a little bit about, and I'm going to run through each of these slides. We have different examples per channel, what the most successful type of content looks like on each channel. So here we have a tweet. Obviously has to be less than 140 characters. Images work extremely well on Twitter. So whether you are pulling a stock image or have a photo from an event or something that you're using from a different channel or from your website, images really make things pop, and your audiences are going to be much more likely to click through and to pay attention to what you're saying. I think the other key here that we're going to talk about a little bit more in detail later is hashtags. So looking for what people are already talking about, the hashtags that are popular with them already, and kind of what kind of content will work with each hashtag is very important to making sure that your content is out there and that people really can search and find it. The last point here is that if you are talking to someone in particular and you want to tag their handle, so for example, if you are CMS, for example, and you want to talk to healthcare.gov, you just put a period before their handle, and that ensures that everyone can see that message rather than just that person. Great. So here we have a good example of a LinkedIn post. Again, photos are kind of key here. They can be a large image, they can be this small thumbnail image as you see here. And these really just, again, make the content pop out a little more. People tend to skip over text-based content. Images are really key to breaking through all of the noise that's out there. Here, moving on to Facebook. So Facebook, in addition to Twitter, is really a great place to respond to comments and to talk to your audiences based on the questions they may have. So Facebook, I'm sure you've all seen, you get a lot of comments, often questions, and it's really important to be aware of what people are saying, and to kind of formulate a response that might work for you, whether that's providing them with more information on a website, whether that is just letting them know dates and times and that kind of thing, or kind of a surprise and delight type tactic of just thanking them for commenting and directing them to the right information. YouTube, I think, fairly self-explanatory. So again, YouTube is the second largest search engine after Google. So definitely a very important place if you do have videos to upload them there. People are more likely to find them on YouTube than if they're looking through a website or that kind of thing. And again, a very nice visual way to tell your story that you can also use on other channels. And Instagram, again, a very visual way to talk to your audiences. I think this also resonates very well with consumers. So that might be a nice way to talk directly to communities as well. All right, so as we've already discussed a little bit, engagement is really key here to all social media channels. So whether you are responding to a certain person because they've talked to you directly, or whether you're looking for specific conversations around a hashtag or around a keyword that you can search on Twitter or Facebook, making sure that you're part of those conversations and taking a proactive part in what people are talking about. So as I mentioned, hashtags are also key to success here. So they're a really awesome opportunity to expand your reach both within your audiences and beyond. So whether that's kind of earned media, whether that's other partners, or again, directly with your audiences, it's a way to join conversation and also drive the conversation forward. Hashtags are an option now on Facebook, Google+, Twitter, and Instagram. So they're also a great way to search. I'm sure people look for specific hashtags to find out more information. So if you're out there with that content using the correct hashtag, then that's an awesome way to get ahead of yourself. Okay, we can So these just go into a little bit more detail of the way that people use hashtags on Twitter and Facebook. So I definitely recommend looking through some of these stats later. They're very helpful. All right. And some quick do's and don'ts, just kind of when you're in doubt or if you're thinking through certain opportunities on social and not sure where to go from here, I'd strongly recommend just looking at these. I think the key overall is that the information you post is public. So thinking through everything as though it is something that you would say to a friend or a colleague, and something that you are comfortable being out there online is really the golden rule of social media. All right, thanks so much.
Great. Thank you very much, Jenna. We really appreciate you sharing all these tips and information with us. Digital paid media has made it possible for anyone to purchase an advertisement, which is great because you don't have to necessarily rely on a third party to help you make your purchases and to put your advertising strategy in play. So we have another poll question here. Have you ever used paid social media? Please submit your vote by clicking on an answer that is on your screen. And we'll give everyone just a second to submit their response. And I will also turn it over to Kelly Vangelis, who is with GMMB.
Hi there. My name is Kelly Vangelis, and I work at GMMB on our digital media team. We run a lot of campaigns for a variety of clients. A lot of them are smaller healthcare organizations, like many of you on the call. So today I'm just going to be talking through some of the platforms that we regularly recommend and kind of the pros and cons of different platforms and the advertisements that you can do on those platforms. So it looks like some people have done paid advertising, but a majority of you have not. So this will hopefully be really helpful for you today to figure out more about where you can advertise and what kind of the best platform would be for you. So next slide. Why would you want to use paid social media? Getting on social media is great because you're meeting people where they are. So you're not tracking them down on random websites across the internet, but you're going to the places where people choose to spend their free time. People go to Facebook, they go to Twitter, they go to LinkedIn when they have the time. So it's a great opportunity to connect with people. It's easier to drive results with smaller budgets. You don't need to be spending thousands of dollars on advertising. You can even spend just a few $100, and you can still drive really quality traffic and get great engagement. What's great about social media is that a lot of the platforms have really advanced targeting and stuff that might seem a little weird at first, but it's really great how you're able to connect with people who have very distinct qualities that you want to find. And finally, most of these platforms are user-friendly and fairly easy to set up. So next slide. Great. So these are some of the platforms that we regularly advertise on with our clients. We have Facebook, Twitter, LinkedIn, YouTube, Instagram, and Snapchat. And all of these platforms offer advertising, but one of the things that's important to remind yourself of during a campaign is what your goal is and who your audience are. So I think it's best to think of the way that you personally use each platform. If you're like me, you go to Twitter for real-time news updates. You go to LinkedIn to update yourself on your industry and professional relationships. And Facebook is used most often to connect with friends and family. So think of your mindset when you're looking through each of these platforms. When you're on Facebook, you're thinking of your children or your nieces, nephews, stuff like that. And so when an organization can connect with you and say that your child may need health care and we can help you, that's when a real connection can be made. Each platform has a different audience and requires different levels of budget and time to implement and monitor campaigns. So for the purposes of this presentation, we're going to briefly cover LinkedIn and Twitter advertising and then take a deeper dive into Facebook. And something that a lot of people also ask about is search advertising, which you'll see on Google or Bing. And that's also an option when your budget is more restricted, but it can take time to implement and is not as accessible as some of the social media platforms. But at the end of the presentation, we'll provide you with a resource to look into social media advertising. So first we have LinkedIn. One of the great things about LinkedIn is that you can narrowly target people by their job title, their industry, or their seniority in a position, because when you're building your LinkedIn profile, you're supplying all this information to LinkedIn so they can go back and then use that to target. So when people are going to LinkedIn, they're looking for news about their industry or something related to their career. So it's best to advertise here when your message is related to their career. One of the examples we have here is a campaign that we did for UW-Medicine, which is a hospital in Washington State. And they were looking for people who worked for Boeing because those people qualified for a certain healthcare initiative. So we were able to target those people and send sponsored updates to them and telling them they qualified for this special healthcare. So again, this message applied to their career so that when they were on LinkedIn looking for updates about their industry, we hit them with this messaging and were able to help them sign up for healthcare. So LinkedIn is also really good for connecting with partners and other stakeholders and is not necessarily the best consumer-facing platform. So you'll only want to be here on certain occasions. So next we have Twitter. And Twitter is good for raising kind of general awareness of your organization and connecting with people, but it may not be your best option when you're looking to target families and individual consumers. One of the pros of Twitter is you're driving conversation and promoting awareness. So you can insert your message into relevant conversations and connect with other organizations using the hashtags and targeting certain handles. There are three main types of advertisements that are kind of the most easiest to use on Twitter. The first one is going to be promoted tweets. And there, your goal is just to drive engagement. So you want people to see your message. You want them to engage with your organization. So you can encourage them to retweet a message. You can encourage them to reply and let them know and let your organization know what their thoughts are, something along the lines of that. The next is promoted accounts. So if you're kind of just kicking off your Twitter and you want to quickly gain some quality followers, you can run a promoted account campaign and find people across the U.S. who are interested in healthcare, who are looking for coverage or anything like that. And the final thing is promoted video. So if you have a great video that you want people to see, you can push it out on Twitter, and it's really great for raising awareness of your organization. So now we're going to take a deeper dive into Facebook. So one of the great things about Facebook is that they have really advanced targeting capabilities. So it's the best way to drive traffic to a website with a smaller budget. And the great thing about Facebook is that it's fairly easy to set up and maintain. So how targeting works on Facebook is that they build segments off of the data that you've already provided, just like LinkedIn. So when you're creating your Facebook profile, you're putting in your birthday, you're putting in who your family members are, you're liking certain pages that shows what you're interested in. So if I wanted to go in and find women in a certain city who make a certain level of income and have children, Facebook can allow you to do that. Another great thing about Facebook is they partner with third-party data providers. So these targeting segments are built off the information that you're putting into your profile, but also they're getting data from third parties who can combine that with their data and then build a more advanced profile of you. So again, you are able to target certain families with low income levels or in their parental status. And with Facebook advertising, you're not reaching just your followers, but over the 1 billion daily active users. So the audience is huge on Facebook. So we get a lot of questions about where do you even start with Facebook. So how to set it up is fairly easy. It's going to take some time to kind of get comfortable with setting up a Facebook campaign, but the first thing that you're going to want to do is determine, at the end of the day, what is your goal? Do you want to get people to like your page? Then you're going to want to run a page likes campaign. Are you interested in driving traffic to a website, getting people to the sign-up form online? Then you're going to want to run a click to website campaign. So it's really important to think through what is your KPI or key performance indicator And then from there, you choose what kind of campaign you want and what your creative will look like. So next, we have just examples of kind of the Facebook ads you can run. The one on the left is what a standard click-to-website ad looks like. So this is when you want to drive traffic to a website. And I'm sure many of you have seen these in your profile before or seen them in your news feed before. So they live in the news feed, and they can be run on desktop or mobile. And the standard click-through rate is going to be between 0.75% to 1%. So when you think about it, that might seem kind of small, but you are reaching over 1 billion, the potential to reach over 1 billion people, so you are seeing really high amount of clicks. So, for example, if you had maybe a budget of $500, you could drive over 1,000 clicks to your website, because on Facebook, you're only paying for what you want. So if you only want to pay for a click, that's what you're going to end up paying for, and it costs per click. If you're running the campaign right and optimizing and continually looking for improvements, you could get a cost per click for as low as 40 cents. So it's really cost efficient. And then you see on the left is what a Facebook video ad looks like, and Facebook is only second or third to some of the larger video platforms, the amount of video views that they see a day. So it's a great platform for, again, if you have a video asset, you want to raise awareness and promote your message or promote your organization. And the standard completion rate on a 30-second video is going to be between 1% to 3%. So along with click-to-website ads and video ads, you can also promote an event. So if you have an event going on in your community, you create the event on Facebook, and then you can go in and promote it with that same targeting that we set up in the beginning to moms in your community. And you can also just promote a standard post. So if you have a funny image or message that you want to get out and just get people to see and engage with, you can just promote that and encourage people to like, share, or comment on it. So the takeaway here is, at the end of the day, there are a variety for options when you're looking to do social media advertising, but you have to keep in mind your limitations and ultimately what your goal is. So as someone who works in social media every day, I see real value in Facebook because of their rich targeting and the fact that you can see results at an effective cost. So finally, this is just a few links to some resources that you can take time to look through later on. We have the Facebook Ads Guide, which just goes to different products and what they look like and different image sizes, stuff like that. We also have the Twitter product guide, followed by the LinkedIn marketing guide. And then finally, if you are interested in running search advertising, there's a link to Google AdWords, which is going to be the easiest way to set up a search advertising campaign. Thank you.
Great. Thank you very much, Kelly, for providing insights on how organizations of all sizes can leverage paid media in their outreach efforts. We've got one final presentation. Our final presenters are Betty Cruz and Sarah Mayer, and they will discuss how Healthy Together in Pittsburgh use social media and digital paid advertising to increase awareness in the city's health initiative. Betty and Sarah?
Hi there. So this is Betty Cruz, and I'm here with Sarah. And before we jump into our strategy, I will state the obvious here, that it's really about having a solid and engaging campaign, and really then from there building on that to use important levers like social media to reach our constituents. In the mayor's office, when we were selected by the National League of Cities to receive to implement this grant, it was from the planning phase to the implementation phase and onward. It's been about building collaborations and partnerships. So we've worked closely with many nonprofit partners. And I say that because I think it speaks to some of the points that were made earlier about authentically engaging with the community. We try, as you go through the slides, you'll see we also try to make sure we're being culturally appropriate and again, just really engaging with the community in a way that's going to resonate. Next slide.
So this is Sarah. We were brought on by the mayor's office and worked with Betty to develop the Healthy Together brand. And as she mentioned, it was really important to build the images around photos that would resonate with the audience, that would be relevant, and that were appropriate culturally. Additionally, the brand itself, the Healthy Together logo, we coined the tagline, "Get enrolled, stay enrolled," both extremely important aspects of the campaign, not just about being enrolled, but also re-enrolling and staying covered. So that tagline, we meant it also to be expandable or adaptable so that we have versions of this logo where it says dial 211 for help, where we can also put in other taglines depending on its use and where it's going to show up. Additionally, we created, as Betty said, it was really important to create authentic ways to engage with not only parents, but with children as well. The organization and the committee was going to a lot of outreach events and tabling events, and so we created Enrollobot, and he is a robot that helps families get enrolled in health insurance and health coverage. And so he is used throughout the campaign and a lot in social media because he increases engagement with the brand.
Yeah, and our reach, we were also, again, prioritizing publishing, running articles or running ads, I should say, in neighborhood papers too, so working with community associations as well and others, and getting them to circulate it through their social networks. So giving them sample tweets, giving them the blurb that they can include in their newsletter.
Mm-hmm. Yep. Next slide. So much like you've already heard from the other presenters, when we look at the channels that we chose, Facebook made a lot of sense. Obviously, there's a huge mass of humans on Facebook, but the primary audience that we're seeking to engage with is on Facebook. We also did some research and found that they were also on Twitter. We didn't explore really additional channels because we wanted to make this scalable for the team. We didn't want to put up a bunch of channels that then would be abandoned after the campaign when maybe resources weren't available. So we wanted to keep it really manageable and not, explore 4 or 5 different channels. So we kept it to the 2 that made most sense for engagement with our particular audience.
Yeah, and I'll add to that I've had the benefit of having AmeriCorps Vistas serve in the mayor's office, and we didn't have paid staff that could do this work, but we had a fantastic Vista who helped me, build capacity and was able, with the right coaching, to really run with it. And that's a tremendous resource that we were lucky to have.
So what did we post and what did we find that did well? Stories and narrative are going to always be great ways to engage the audience, but specifically images and video did really, really well, and you'll see in the next couple of slides in particular what kinds of images and video. Participating in discussions, really important not to let a comment hang there, but to respond to somebody immediately if they had a question. And then additionally, connecting with influencers around this issue who are also, involved in and had touch with our audience. So as Betty said earlier, we would create sample posts that they could share on their own social media channels and in their newsletters and wherever it is they wanted to share the message. But we packaged that for them so that it was easy to have them participate.
Yeah, and that was a combination of, like I was saying before, the community partners, but also internally, our community affairs team or across the hall, our city council members always want to know what resources there are in the community when they're meeting with their constituents, and certainly this being a campaign of the mayor, being able to say what's happening, that it's a resource and something that they can give and share out is always appreciated. The next slide here is just a couple of examples from our page. little video that we had put together and then shared during one of our community outreach. That's Enrollobot right there with children who love him, and then an article that we pushed out. So it's really a combination of news that we're getting coverage on. Yesterday we had an open enrollment event in City Hall, so we pushed that out, and you'll see that in another slide. But as was said before, anytime that we can use images or video to be more engaging, it tends to resonate most.
Yeah, and the other thing that's in this slide is a particular hashtag, Wellness Wednesday. So as it was said earlier, researching creating your own hashtags can be very useful, but there's a lot of pre-existing hashtags that you can use to, extend your messaging beyond.
And to that point, I would say when we were, or throughout the campaign, we've tried to have some presence at least a few days a week where we're posting, sometimes more aggressively, multiple times a day. Probably not going more than 2 or 3 times a day to not saturate folks. But Wellness Wednesday is one that we're typically trying to keep an eye out, retweeting or posting fresh content.
So this is some of our Twitter posts that had a lot of high engagement, and you can see that a lot of the photos are around Enrollobot and a campaign or sort of a mini campaign inside of Healthy Together that we did called March Pittsburgh that we'll talk about more in depth later on. But we're using a mix of pictures, and then you also see 2 text tweets that are using hashtags and that are just informational and helpful for getting the news out in a quick way. Next slide.
Next slide.
Thanks.
No,
back one. There you go. So this is an example of a series of images that we created to tell a story about, Enrollobot's life and how he lives his life healthfully and contributes to lots of different things. And we used it on Facebook and Twitter. We have him in different places outside of the campaign. So have him visiting a farmer's market and him making a smoothie and him doing exercise. And we really just wanted to give Enrollobot a little backstory and expand him beyond just healthcare.
Yeah, because the Healthy Together campaign is part of a larger umbrella initiative called Live Well Pittsburgh. So as the brand was being developed, also Healthy Together starting to focus as an enrollment campaign, but thinking about how this can grow over time to encompass other areas. We also have a separate campaign called Grab Up that Shift also helped us to build out. So really looking at how Enrollobot and the brand itself can go beyond healthcare enrollment, even though that's where we started.
So the next few slides are just taking us through both the organic results of particular posts and then some of our paid results. And so, I think that this particular post did well. It has 2 elements, sort of best practices. One is it's using a hashtag. Actually 3 things that it's doing really well. It's using a hashtag, it's using images to engage, and we tagged the people that were in the image to extend the reach beyond just our audience. So those are little tips of how you can get a little bit more exposure for your post. So this particular tweet here is showing, a good level of engagement. We are tagging electeds in here, so our council members are tagged in here, and another local organization that focuses on youth. And so it had a good one, the one on the left, and then the 2 in the middle are related to, one of them is related, or actually both of them are related to the March Pittsburgh event that we did, and they had a pretty high level of engagement as well. So early on, to initially kickstart or jumpstart the Facebook audience, because I would say we focused a lot of our effort initially on Facebook growth. Twitter, really, we didn't do any advertising in Twitter to grow the audience. It came organically. Facebook, though, we wanted to make sure that the majority of the followers there were in our target audience, so we did a campaign to grow that, which I'll talk about on the next slide, I believe. But we have about 408 followers. The majority of those fans are female, and they're in the 25 to 34 age range. With Twitter, as I mentioned, it's a lot of organic growth, and we get about 1 new follower per day on Twitter, and that, goes to show that we're doing some of the right things, or Betty and her team are doing a lot of the right things to post relevant content that people are interested in getting.
And one thing that we didn't mention yet, I don't think that helped to grow the numbers and build awareness, is we had a tweet chat or a Twitter party with our public health director. She was taking questions. A county health director was taking questions, and for 1 hour in the middle of the day was addressing, raising awareness around this issue and answering questions, which was really engaging.
Yeah, and I think we also did that on a Wellness Wednesday, so we were able to use the hashtag to extend the coverage on that. This slide is showing the likes campaign that we did, and so we were able to drive 283 likes to the page. So over half of the likes came from an ad campaign, and it reflects what the general audience of the page is. It's more heavily focused on females. We've got 80% of our fans are female, and they fall into the 25 to 44 age range, which is really right where we want to be. So we also did, in addition to doing a likes campaign, we did some promoted posts. These are just 2 examples. We did an event, and we promoted that event, and then there was a particular post that we promoted. And, the responses and the people that are interacting with this is, again, heavily female, because that's how we're targeting our advertising to make sure that we're getting the right audience there to see the things that are important for them to see that we're doing. So this is some of the creative that we did around the tweet chat, and we pushed this out on Twitter and on Facebook, and we also sent invites to lots of different organizations. We sent an email invite that included this same creative. We created a special landing page on the website so that people could submit their questions early on or the morning of the event. So we tried to really kind of hit it from all aspects.
And I will say one of the things that was mentioned earlier is, what's the purpose? So what's your brand? What does that look like and feel like? But what's your end goal? Our end goal is around this campaign has been prioritizing healthcare enrollment. So getting that message out and really lifting up our community partners who are the experts and do this work. So as much as we were able to get others to share on their Twitter or on their social media pages or to reach the community, that's what's most important for us. So we were able to work with mom bloggers and other networks. And so maybe it wasn't coming from our Twitter page, but again, the end goal for us is really to get others building awareness so that our partners who offer these free help and the community gets the help, are connected and get the help that they need.
That's right. The March Pittsburgh event, just to go back one slide real quickly, I want to focus on those because it was a series of 10 marches that we were able to get sponsorship from one of our major providers here, which helped us to do the event. But really the goal of that event was to have true engagement in the community and be able to give people the opportunity to get their questions asked or answered by our partners that Betty just mentioned. And so each of these marches were paired with a community event where we could have a table. So we marched around with Enrollabot and a band, a very New Orleans style second line parading, and it was a lot of fun through the summer months, but really was a key engagement tool to reach directly into the community with the campaign.
I think that's it.
Yeah, I think that's all we have.
Thank you.
Great. Thank you very much, Sarah and Betty, for explaining how Healthy Together was able to increase its social media following and reach more families in Pittsburgh. We appreciate all that you shared with us. I know we're coming up close to the end of the hour here, but we've got one more poll question. What type of resources would be helpful in your outreach efforts? if you can please answer the poll question, that would be really helpful for us. And just submit your vote by clicking on an answer that is on your screen. And I'm just going to briefly talk about some of the Connecting Kids to Coverage campaign resources that we have, and I want to make sure that we leave some time for some questions as well. So I'm going to just cover this pretty quickly. The Connecting Kids to Coverage national campaign has a number of online communications tools on insurekidsnow.gov. We've got web banners and buttons, social media graphics. We've got posts for Facebook and Twitter. We've got some I mentioned the web banners. We've participated in blog carnivals. We're going to be participating in a Twitter chat next month with some of our partners. But we've got tools on insurekidsnow.gov that you can look at. And then we also have a step-by-step guide for how you can share the Facebook and Twitter posts. So that is on our website as well. And our webinars, we have an archive of webinars available on InsureKids Now. And then we also have a video library of different organizations that we've worked with that are engaging in outreach and enrollment efforts and showcasing some best practices. And if you'd like to keep in touch with the campaign and sign up for our e-newsletter, there's a link here for that. And then you're always welcome to email us at connectingkids@cms.hhs.gov. And you can follow us at IKNGov. And we've been using the hashtag Enroll365 for the last couple of years. And that is a great way to engage with the campaign on social media, as well as using the hashtag Medicaid and SHIP. So I'm going to turn this over to Erin again. She's going to talk through the questions that we've received so far.
Thank you, Jessica. We've been monitoring your questions throughout the webinar and want to take the opportunity to address some of these questions. And thank you all for your responses to the poll questions. That's very helpful to help make sure we have the best content to help you all do your jobs. So just a reminder, if you do have a question, please type it in the question section. Since we just do have a few minutes, if we don't get to your question on the webinar today, we will make sure to follow up in the chat panel. So I want to go ahead and get started with two questions on paid media. So I'm going to ask Kelly and then Sarah and Betty, if you'd like to jump in here as well, that would be great. I'm going to combine two of the questions. One is please define a smaller budget, and then what does that ROI, that return on investment, look like for social media advertising?
Sure. So this is Kelly. A smaller budget can really be whatever you want it to be. One of the great things about advertising on Facebook is that you can choose to spend per day. So if you want to spend $20 a day on advertising, you can set it up that way so that you can continually monitor and make sure that you are getting that good return on investment. It can be hard with social media to figure out what your hard return on investment is, but it's important to take a lot of different factors into play. So you want to look at the cost per click if you're running a click-to-website campaign or a cost per view, and making sure that it's the most efficient cost for you. You also want to look at the engagement that you get on some of the posts, because even if people are maybe not clicking through on it, they might be engaging with your content, liking, commenting. So you are getting more value out of a post other than just the click or the video view. And again, social media advertising is a great supplement to other outreach efforts. It shouldn't be your only way of interacting with your organization's only way of interacting with others, but it is a great complement to other outreach efforts.
Thank you, Kelly. So one additional question on paid media, and I think this is a good question for the whole group, since this is the target audience we're trying to reach, is what is the best way to target people on Facebook under the $30,000 income? The third party do not show lower income as target options on Facebook ads.
Right. So unfortunately, that is one of the drawbacks of Facebook, is that you can't target people who make under $30K annually. The lowest you can go is that $30 to $40K bracket. So there are ways you could get around that by targeting by interest or sort of behaviors that people do, because beyond the demographical targeting that you can do, there's also interest targeting, so people who are interested in certain pages or who are continually looking for certain kind of content on Facebook, you can just start typing in keywords and you can see what interests come up. There's also behavioral targeting you can do, so what are the behaviors of people online? Are they frequently shopping online or something like that? There are other ways around that, but again, it's just with Facebook, they do have certain privacy restrictions, so targeting people under 30K is not possible now.
This is Sarah. I would just add that for our campaign, we identified particular neighborhoods that had the greatest need, and so we could hone our advertising spend to those particular zip codes, so that we were making sure that in addition to all of the other great things that Kelly said, that we could geographically focus to the areas we knew had need.
Great, thank you both. And thank you everyone for submitting your questions. For the questions that we didn't get to today, we will be addressing those in the question panel. Please follow up if you do have any additional questions following the presentation today. So thank you for joining us. Remember, there are campaign resources available for download and to customize on the insurekidsnow.gov website. A recording of the webinar will be available on the website in 2 weeks. If you've missed any past webinars, check out the webinar on archive on insurekidsnow.gov. Thank you again, and please have a great afternoon.